HealthWorks, providing trusted, culturally appropriate information and resources. We aim to strengthen vaccine confidence and prevent outbreaks of vaccine-preventable diseases where we live, worship, work, and play. Increasing access to vaccine and booster shots for diverse, medically underserved populations. Engaging communities, families, and businesses in the fight against COVID-19.
Thank you for joining us. I'm Kermit Payne of One Joshua Group, and we're here today to speak with Dr. Eboni Haynes of the ASHLIN Management Group, and our guest today is Mr. Jason Luntz of the JLuntz Group. Welcome.
Hello.
Thank you. It's good to be here.
So, Dr. Haynes, in this consortium that's comprised of Meharry Medical College, Morehouse School of Medicine, and the ASHLIN Management Group, ASHLIN Management Group is not an academic institution. How does a partnership or consortium like this come to being?
Thanks for the question. It's funny that you should ask that because so often businesses aren't involved in the conversations that are had when we're talking about rolling out public health initiatives. But I have to say, the CEO of ASHLIN Management Group has been very visionary in that way. Last year, in the height of COVID, Mrs. Botts, Linda Botts, pulled together a team of thought leaders from the CDC Foundation, CDC, FDA, as well as some academic institutions and hospitals to have a national webinar to talk about what it looks like to involve businesses, and in particular, small businesses, in the conversation around COVID-19 mitigation and preparing individuals to address any other pandemic or any other public health emergency that might come down the pipeline. And one of the things that came out of that discussion was that absolutely we should be involving businesses, small businesses, large businesses, medium-sized businesses in this conversation around COVID for the right now, for the time being, but also involving businesses in conversations around public health emergencies in general. We shouldn't be excluding any sector of our community from these discussions and involving them, because we really need a all hands on deck approach to this work. So Mrs. Botts has been very visionary in that effort, and she's really the one who approached the other collaborative members to say, what would this look like if we were able to take advantage of this HRSA funding to engage our business partners in this fight against COVID-19. So in a nutshell, that's how it came together.
So we thank you for that. And so, Jason of the JLuntz Report, I would assume that you're a small business.
Yes,
And
yes,
you are
I am.
you're integrated in this HealthWorks through ASHLIN Management. You want to tell us something about the JLuntz Report, and then we're going to come back and ask you. Dr. Haynes talked about how we arrived through the consortium, and I understand that there's some training involved. So, can you tell us about the JLuntz Report and how you're involved with HealthWorks?
Yes, so the JLuntz Report, that's my personal brand where I do speaking engagements, I do social media consulting, and I help brands grow their online presence. I also own a business, UrVoyce, and UrVoice is a web design, online branding marketing firm. So between both of those brands, our goal is to basically be your voice online. So we just like to help brands, nonprofits, small businesses have the same tools that their larger counterparts have when it comes to the online space. And I've had the opportunity to work with HealthWorks. Was able to sign up Your Voice and go through the training that you're going to discuss shortly, to learn the benefits of the vaccination and the benefits of the people that I work with in my community being vaccinated. So it's been a really good experience so far.
Dr. Haynes, because you've been critical to helping oversee, develop the training. I would like for you, and you're a lot more familiar with this than I am. I really would like for you to speak to Jason about how the training benefits the JLuntz Report and other organizations like that. And because when Joshua gives a small business, we're going to sit back and listen and see how we could benefit from that kind of training as well.
Absolutely. So, one of the things that the training does is it provides an opportunity for what we call small business health ambassadors. That's an individual who is identified by the leadership of the minority business enterprise to complete the training, learn all it is that they can learn about COVID-19, about its impact on communities, about the importance of vaccinations for even now our youngest of the population, right? So that they are armed with all of the information that they need in order for them to present factual information, to do some of that myth busting within their own organizations, among their employees and leaders, but also among the community members that they might interact with, right? These businesses exist in local communities. And so we anticipate, and we have anticipated that those businesses have been part of, very much part of the community, integrated in those communities, and very much respected by the communities. And so one of the other aspects of the program is that once these ambassadors get trained, they are expected to do two things: develop an action plan. And that action plan says, now that I've been through this training and I understand how important it is for us to make sure that our community is, as a whole, not just our employees, but our community as a whole, get vaccinated. What are some things that I can do within my organization to make sure that employees get factual information and know where to go for vaccines and booster shots? But also, what are some of the things that I can do in my local community to make sure that people are getting factual information and know where to go to get vaccines and booster shots? And then they put that action plan into place. And so, Jason has been really integral in not only, in his own organization, making sure that they have an action plan that says what we're going to do for our employees, but also what we're going to do in the local community. Jason is also one of our business recruiters. And so he's out there saying, I'm an example. I've done this. I know exactly what to expect, and I believe in it. And so I want you to come on board and help us make sure that we're getting the most people within our local communities vaccinated. So maybe Jason can talk about what that's been like and what he's been hearing from some of the other small businesses that he's been connecting with to recruit them to the program.
Yes, as a business recruiter, that's also been a really valuable experience because I've had the chance to reconnect with a lot of my business associates that I've had relationships with over the years. But because of COVID, a lot of us actually lost touch with each other. We didn't see each other at networking events. We didn't work together as much as we used to. So this experience actually has reunited me with so many people here in Nashville and a lot of my Atlanta connections as well. So we've had time to have conversations because the first thing we talk about is, man, I haven't seen you since the pandemic. Well, speaking of the pandemic, listen, I got something that's really great for you. One of the most important things is when we're speaking to these business owners is letting them know how important this is for their community. I'm a firm believer that particularly in the Black community and other minority communities, that entrepreneurs are the rock stars now. Everybody back in the day wanted to be rappers and basketball players. Now the basketball players and rappers want to be entrepreneurs. So when you see someone that has their own business and they're paving their own way, people look up to that. So if our businesses are in the forefront of getting vaccinated and speaking about the importance of vaccinations and boosting, it's going to spread amongst the rest of the community. The community wants to be a part of that conversation because they look up to entrepreneurs, they look up to small business owners, they look up to business as a whole because it's the foundation of who we are nowadays. We all want to be in control of our own destiny, so entrepreneurs are leading that fight. So I think the connection of business and health is such an important thing. And it's one of the positive things that has come out of the pandemic is we're now able to talk about these health issues in a better way.
So Dr. Haynes and Jason, now I heard you mention something as a um, small business owner that kind of scares me. It's like training. How much time does that take? What is it? Certainly, I recognize it's an investment in my community. I recognize it's an investment in my business, but I don't have a lot of time. So, how, Dr. Haynes and Jason, for you, how does that work with my commitment of time for the greater good? So, tell us about that.
Yeah, so I'll jump in first. We developed the training with small businesses in mind. We recognize that their time is very valuable and is very limited. And so we have two modes of training for our small business health ambassadors. The training that we rolled out initially was a web based training model. And so ambassadors could go online, they could log in whenever they had time, they could complete these different modules, and they would get all of that information through this online portal. So they would watch some videos and listen to the speakers share this information with them. And after they complete those three modules, then their training is complete. Then they just go to putting their action plan together. And that training really only takes about, if you were to sit down and do that training all at one time, it probably would take you maybe about an hour and a half or less to get through all of it. But we wanted to incorporate those adult learning principles. Make sure that individuals felt like this was still something doable for them, even if they have a busy workday. So we created that format. The other format, which we're rolling out next week, is a format where these small business health ambassadors can get their training during a live virtual event. And so that live virtual event will take place over an hour and a half, but they'll have someone who's facilitating the conversations, leading them through the educational materials. They will go into breakout groups where they will have interactive activities with other ambassadors, but they'll be done with that training component within an hour and a half. But they still have to do their action plan, which doesn't take very long. And maybe Jason can talk a little bit more about his experience with the action plan. But after that, they're done with the training. Then they get to move on into getting their employees and their community members vaccinated. But right before I pass the virtual mic over to Jason, I'll say that I mentioned before that we developed this with small businesses in mind. And so the small businesses are not doing this work and not being compensated. That's another aspect that I think is important for us to highlight. Our businesses that come on board are eligible for multiple incentives for participating. So just getting through the training means that they are eligible for the first incentive of $1,000. And then they get another incentive of $1,000 for organizing those vaccination events and getting people vaccinated. So we recognize, especially, coming out of the pandemic, I'm an optimist, so I'm going to say we're coming out of the pandemic, right? We want to make sure that small businesses can, stay afloat and that they can pay employees who might be, serving as ambassadors. And so we want to make sure that we're incentivizing their time.
Yes, and I wanted to point out that, another great thing about the training is, like you said an hour and a half. I like to tell people up to 3 hours so they have it in their mind. But you're right. If you just sat down, you can get through it, and it's some really good information. One thing I love about it, and I explain to people, is it also saves as you move along. So if you are busy, which a lot of small business owners are, if you got 30 minutes here, you can do some and stop, and it will pick right up. So that's also a great advantage of the system that has been developed. And also, and I think you alluded to this, you can also have one of your employees, you can assign an employee to actually be the ambassador within your business. So that means you may be the owner and yeah, you have a million things going on, but you can have one of your employees and give them that task for the next couple of days. So I've had businesses do that where they've had their assistant or someone in the business that they sat down, they were able to complete it. They did the action plan, and now they're being compensated. The compensation is important because we understand that as business owners, you are busy and you have a lot going on. So it's not just about the money, but the money is important because we understand that any kind of injection of cash right now is helpful after the pandemic. We also respect your time, so we want to make it worth it. So it has a lot of great things to the program. You're learning a lot. You're making a difference in your community with your employees and your customers and everyone that you're around, and you're also being compensated. So to me, it's a win-win on so many different levels.
It sounds like an excellent opportunity for businesses, small businesses and large businesses, to be involved. First of all, to be certified, to know what the facts are, what accurate information is about COVID-19. Jason mentioned it's an opportunity to network. Both Dr. Haynes and Jason talked about the compensation as an incentive. But much more so, I think the greater good of this is that we're able to contribute to our communities. We have a responsibility. We know that from having started a business, but we certainly have a broader responsibility as a business owner to contribute to our community. Jason and I had a conversation earlier about the bodegos. So we know that we live in those communities where those bodegos are people that we know. Those are our family members, families of people we grew up with. So we continue. And the important part and part of what we do with COVID-19 and HealthWorks, we're able to continue to contribute with these very same dollars, put those back into our community. That in itself is another kind of empowerment. Now, Jason, so what are you going to do with this training? You're training other people after the HealthWorks program ends. How do you think that this training is going to help you um, post the completion of the HealthWorks program?
Well, I know personally, I'm already in the process of working on putting together some actual events where people can get vaccinated and boosted. Um, and it was funny because initially I was really focusing on the boosting aspect because a lot of people that haven't been vaccinated felt like they're not going to do it. But then when the news came down that now children can get vaccinated, that is an opportunity for us to continue to do this work. So already trying to connect with various health related organizations here in Nashville that I'm already have relationships with. So being able to put those events together is very important. Trying to hit that target number that we're asked of is a focus. So with the training, that's one thing is the actual actually putting together events, but also having the confidence to speak further about the importance of being vaccinated and boosted, even in social settings, because we still run into people at get-togethers when you're hanging out who start saying that they will not get vaccinated no matter what. They're not falling for it, whatever their reasons are. And so now I have even more tools to basically explain to them in a respectful manner because everyone's body is their body. So I can't force my opinion on you, but I'm not just giving you my opinion now. I've actually learned real facts on why this vaccine is important. So it's given me that strength to continue the conversation with those who are a little skeptical still of the
And
vaccine.
we see, if I don't mind jumping in, we also see this really as an opportunity to help small businesses really build their base of customers, of partners in the future. Because, through the vaccination events that they are going to participate in, organize and participate in, they are actually doing a lot of outreach to some partners that maybe traditionally they don't work with. So when Jason mentioned the fact that now, children, younger children are able to get vaccinated, now our businesses are able to connect with some of those youth serving organizations within their communities that maybe they hadn't connected with before. And so when you think about, these these businesses within these local communities now partnering with YMCA's and Boys and Girls Clubs and nursing homes and, other organizations, maybe, organizations that they traditionally haven't worked with, there's an opportunity for those businesses to get the word out, about themselves and who they are and what they offer. And so long term, there's the potential there for there to be some business benefits for small businesses as well. So there is that long-term benefit beyond, the vaccinations that we see as well.
So Dr. Haynes said that she was going to pass the virtual mic to Jason. I think she just dropped the mic to tell us that HealthWorks gives us an opportunity to be, as Jason mentioned, being COVID prepared with accurate information to be able to dispel some of the inaccurate information. Dr. Haynes reminds us that the HealthWorks consortium and becoming a business ambassador helps us to build our network, to keep our workforce healthy, to be able to build and contribute to our community. And I think it doesn't get better than that. We give a chance to give, we give a chance to receive. That's a part of the important partnership that HealthWorks provide. Dr. Eboni Haynes and Mr. Jason Luntz, thank you so very much. And Mr. Haynes, could you give us, Mr. Luntz, could you give us your website in the event that we would like to reach out to you so we may need to connect for something else? And Dr. Haynes, we want to hear how we could reach out to you. If you could give us the ASHLIN Management Group contact information as well.
Definitely. My website, and we're available for web design, email marketing, social media consulting, even event planning and strategic communications like what we're doing here with HealthWorks. You can find us at www.urvoyce.com. That's UrVoyce.com. UrVoyce.com. And you can find me and holler at me across the board on any social media at the JLuntz Report, TheJLuntz Report. So DM me and let's make it happen. Thank you.
Yes. So you can connect with ASHLIN Management Group at their website, which is www.ashlin, ASHLIN, And if you want to access the information about the HealthWorks program, you just go to ashlininc.com/HealthWorks.
So thanks both of you for that. And for anyone interested in the overall HealthWorks program, you can go to healthworks.works. I'm Kermit Payne with the One Joshua Group. Thank you. Be safe, be kind, and be compassionate. Until the next time.
We would like to thank our special guests for joining us today. This HealthWorks podcast series is supported by the United States Department of Health and Human Services and the Health Resources and Services Administration. The contents are those of the speakers and do not necessarily represent the official views of, nor an endorsement by, HHS, HRSA, or the U.S. government. Don't forget to subscribe to receive notifications about future episodes, and be sure to share this information with your family, friends, and colleagues. Here's to bringing about a great change and improving health. Until next time, stay safe, be kind, and be compassionate. HealthWorks, providing trusted, culturally appropriate information and resources. We aim to strengthen vaccine confidence and prevent outbreaks of vaccine-preventable diseases where we live, worship, work, and play. Increasing access to vaccine and booster shots for diverse, medically underserved populations. Engaging communities, families, and businesses in the fight against COVID-19.